Woman to Woman has been a great experience for me, and they provided me with so much support. Pamela actually was the one who brought me to Woman to Woman. She's the one who I was able to call when I was homesick and say, what happens when this, when this occurs, when I was getting nauseous, my hair, I was losing my hair. And Pamela was the one that was there for me to give me my strength and the courage and let me know how she went through it and that I would be fine and that I would be okay going through it too. And when I realized how special she was to me, I said, I would like to do that, because I think that the only way I'm going to continue to be strong and support myself is to support others.
My name is Robin Finley, and I am a 9-year survivor of ovarian cancer.
Hi, my name is Jill Robinson. I was diagnosed with cervical cancer at the age of 47, and I am clean 2 years.
I came to see Jill every week during her treatments, and we spoke often even throughout her treatments. And it's been a special relationship. It's been a very special relationship.
I feel like I met a friend and a mentor. Robin just kept saying, yes you are, yes you are, and she kept pushing me. Even when I told her some of the things I went through and I didn't want to do certain treatments, she goes, you're still doing it, you're still going, and we'll see you next week. For women that are hesitant to open up and to talk about what they're going through, I feel that it really helps. It helps their mind, it helps to talk about it. It was very important for me to talk about it and to let everyone know what I was going through, and if I was feeling an emotion that I didn't understand, somebody was there to help me with. When you meet somebody that's friendly in Woman to Woman, a volunteer, somebody, it's easy. They've all been through it. We've all been through it.
Hey, this is Renee Flynn, and I'm in the chemo suite with my oncologist, Dr. Anne-Marie Bedeau, and our first guest, Dr. John Martinetti. This is the first installment of our series, Sweet Talk. So we're going to start off today with a great, intensive topic on gene, what, Anne-Marie?
Translational gene research.
There you go. That's what we're going to talk about, and Anne-Marie is going to take it away.
We're honored today to have as our first guest Dr. John Martinetti. John is an associate professor in genetics and genomic sciences at the Mount Sinai School of Medicine. He's also a clinical professor in pediatrics and in oncologic services. And currently, John, you run the ovarian cancer research translational program at Mount Sinai. I'm so happy that you can do this, and I want to tell you, you're really brave to be our very first guest, and I really appreciate it. I would like to start, John, if you could just tell our viewers a little bit about what you do as a translational researcher. Just give us a broad overview of what you do.
Great. Well, first of all, thank you guys. It's great to be on Fear Factor. So, thank you sincerely both for having me. Well, to kind of give you an overview, Anne-Marie, Dr. Peter Dottino and myself and people from the group here, yourself, Dr. Rudy Segno, we've established at Mount Sinai an ovarian cancer translational research group. And it's a great big title. And really what it means is that in addition to the excellent clinical care that's provided through you guys, what we're trying to do is really establish a foundation for doing research to try moving beyond what's currently known, what's appreciated, and what can be done.
But I think what John's describing is even before they get here, at the time of surgery, he gets some tissue and he banks it. And if you could just tell us a little bit about banking and walk us through that process of tissue banking.
Oh, sure. And the first and probably the most important thing is really the idea and understanding of consent between the patient and the doctor. And so we actually have a form, so in other words, if people in the future really do participate, one of the documents they'll be introduced to, in addition to hearing about, what's going to be happening to them, one of the things that's also asked of them is to participate in this research, and you have to be a willing participant, right, which means you have to understand it. So that's why this kind of a talk is fantastic.